Welcome back to my channel, where we break down complex health topics into easy-to-understand insights. Today, we're diving into a topic that might surprise some of you: the interaction between certain medications and dairy products. We all know dairy offers a fantastic array of health benefits, from robust bone health to reducing the risk of type 2 diabetes and high blood pressure. Daily consumption of dairy foods like milk, cheese, and yogurt is an integral part for building healthy bones throughout the lifespan, from early childhood through late adulthood, as they contain essential nutrients for bone growth and development, including calcium, vitamin D, phosphorus, potassium, and magnesium. So, dairy is undeniably good for us. However, here's the crucial part: while dairy is beneficial, its rich mineral content, particularly calcium, can sometimes interfere with how your body absorbs certain medications. But don't worry, the good news is you don't have to give up dairy. With a few simple adjustments, you can continue to enjoy its many health benefits, while ensuring your medications work optimally. Let's explore 6 key medications, where this interaction is most common and what you can do about it. 1. Tetracycline antibiotics. First up, we have tetracycline antibiotics. These are a class of medications used to treat various bacterial infections, and they include common drugs like democlocycline, doxycycline, S-recycline, and tetracycline itself. The issue here is that the calcium in dairy can form a complex with certain medications such as antibiotics, tetracyclines, and fluoroquinolones, which decreases how much of the medication and nutrient can be absorbed. This complex essentially makes the antibiotic less effective. While not all antibiotics in this class require strict separation, for those that do, the best practice is to take your dose at least 2 hours apart from any dairy consumption. 2. Levothyroxine. Next, let's talk about levothyroxine. This medication is widely prescribed to manage hypothyroidism, a condition where your thyroid gland doesn't produce enough hormones. Similar to tetracyclines, levothyroxine's absorption can be significantly impacted by milk and other dairy foods. Our expert recommends a 4-hour window between taking levothyroxine and consuming dairy products. It's also generally advised to take this medication on an empty stomach for optimal absorption, so timing is key here. 3. Lithium. Our third medication is lithium, often prescribed to treat bipolar disorder, a mental health condition characterized by intense mood swings. Now, this one is a bit different. It's not that dairy directly blocks lithium absorption, but rather that lithium can influence certain nutrient levels found in dairy. Long-term use of lithium can potentially lead to a buildup of calcium in the body. So, while you don't necessarily need to separate them by time, it becomes crucial to monitor your overall calcium intake from both dairy products and calcium supplements to help minimize this potential issue. 4. Baloxavir. If you've ever been hit hard by the flu, you might have been prescribed baloxavir, an antiviral medication. This drug absolutely should not be taken with dairy products. Because of a direct interaction with calcium, the mineral significantly influences the absorption of baloxavir, making it less effective against the flu virus. And it's not just dairy. This interaction also applies to other calcium-rich foods like sardines and tofu, as well as calcium-fortified drinks and over-the-counter antacids like Tums. Tums is 500 milligrams of calcium carbonate, and the same cautions apply with Tums and these different medications. So, be mindful of all sources of calcium when taking baloxavir. 5. Quinolone antibiotics. Next, we have another class of antibiotics: quinolone antibiotics. These are used to treat various bacterial infections, including urinary and respiratory tract infections. Like tetracyclines, some, but not all, quinolone antibiotics need to be separated from dairy. A common example in this group is ciprofloxacin, which must be taken separately from dairy. It is recommended consuming dairy products 2 hours before or 2 hours after taking this medication to ensure proper absorption. 6. Eltrombopag. Finally, let's look at eltrombopag. This medication is prescribed for conditions that result in a low platelet count. For eltrombopag, it's recommended to avoid dairy for 2 hours before or 4 hours after taking the medication. This is due to the same mechanism we've discussed: calcium binding and blocking the drug's absorption. So, there you have it. 6 medications where dairy can play a significant role in their effectiveness. From certain antibiotics to treatments for influenza or hypothyroidism, the interaction is primarily due to calcium binding and reducing drug absorption, or in the case of lithium, influencing calcium levels in your body. But here's our expert take. You absolutely do not need to completely eliminate dairy from your diet. Most of the time, it is possible to properly get the most benefit from your medication and still include dairy in your diet, just not at the same time of day. The key is timing. The specific separation time can vary by medication, so the most important step is always to check with your pharmacist or healthcare provider for personalized advice. They can give you precise instructions based on your specific medication and health needs. Remember, dairy offers many essential vitamins and minerals, helping to fill crucial nutrient gaps like calcium, potassium, and vitamin D. Its multiple health benefits make it well worth the small effort of adjusting your intake. To avoid interactions with your medications, if you found this information helpful, please give this video a thumbs up. Share it with someone who might benefit. And don't forget to subscribe for more expert health insights. Thanks for watching, and we'll see you in the next video.